I think that the danger right now is fentanyl in our drug supply, and that we have folks who are at risk of an overdose that weren't 10 years ago. So somebody who is a methamphetamine user or a cocaine user, for example, those are stimulants. Even those folks are at risk of overdose because fentanyl is largely laced in every drug of abuse on the street. So somebody is maybe thinking they're getting methamphetamine or cocaine, and there's fentanyl in it in large quantities. We also have counterfeit pills that are being made and sold to youth too, by the way. Unfortunately, through social media like Snapchat, there's a DA advisory that was put out on that probably like a year and a half ago. But what's happening is you can purchase pill presses online off the internet, and you can just create a pill that looks like any pharmaceutical. And so you, if you're a person who maybe is dependent on pharmaceutical opioids, you might purchase what you think are pharmaceutical opioids off the street, but those are illicit counterfeit pills, and they very, very often have fentanyl in them. So again, we just have a lot of people that maybe were just dabbling in substances, and now it's become far more risky. They don't have to have a substance use disorder to experience an overdose. They just have to try something, and it has to be, if it's laced with fentanyl, which Dave talked about, extremely potent. Just a small quantity can be deadly. I think the other thing that we mentioned briefly, there were a few questions about xylazine. So xylazine is an alpha 2 agonist. It is not the same as an opioid, not the same as fentanyl, but it also causes deadly respiratory depression. So we now know that xylazine has also been laced in our drug supply, probably for a number of years without us knowing it because we weren't testing for it. Xylazine is a veterinary sedative. It can also be purchased off the internet, gets imported easily and mixed into our drug supply. And again, when you put an opioid, which causes sedation, along with xylazine, which causes sedation, those additive sedative effects are extremely deadly. So I think what we're seeing, those different drivers of the opioid crisis, but we're seeing most recently is fentanyl and then other, excipients that are mixed in, such as xylazine. And I think largely it's just substance use is much more dangerous than it used to be. You could maybe dabble in drugs and try them years ago, and now that's become very dangerous.